Hey, Danny here at PT Biz, and today we're going to talk about a really cool trend that is happening in PT right now and how it can really help your business as well as the lives of all of your patients. So, in the last podcast, I talked about an interaction I had with two different 60-year-olds, like on the dot 60-year-old athletes that were at clinics that I was visiting in Washington, D.C. on a trip that we had to see some clients. And if you haven't listened to that one, go back and listen to last week's podcast to get a better idea of what I'm talking about and the interactions I had with them. But during my time at these clinics, we're at 4, as well as however many number of clinics I've been in the U.S. It's probably 100 at this point. And what I see now that's really interesting, and it's something that, honestly, at the clinic that I started, we've been talking about for a very long time, but maybe wasn't generally as accepted by the masses, is longevity, is wellness, longevity, proactive work, but really the idea of lifestyle medicine. So you can see this is nothing new as far as a trend. If you really are paying attention to this, if you look at the things that Kelly Starrett's been talking about forever, the Peter Attias of the world, the Andrew Hubermans, really talking about the idea of longevity, performance, and being able to do the things you want to do for a very long period of time. But now something interesting is happening. There's starting to become what we call a product market fit or a product service fit or service product fit, right? So like what you're seeing is people are looking for healthcare providers, specialized people that can help them with longevity. They can help them with lifestyle medicine. And now you see this popping up with functional medicine clinics, lifestyle medicine clinics. Med spas are sort of a fringe example of this. Peptide clinics are a fringe example of this as well, where they may be doing things that are not necessarily quite as evidence-based, but even still, people are searching these out because here's what's happened. People realize that they're going to be living longer. The norm of exercise and eating better is changing. It's not just fringe people anymore. These are many people who are not within the healthcare space or within the fitness space that are starting to make habitual changes in their life. I see this with my own friends. So I'm 40 years old, and I see this with my own friends. Recently, I've had friends that have made pretty significant changes where they've either stopped drinking or they've started exercising again, or they've cleaned up their diet, or a number of these things that have made massive changes in their physical health without being prompted to by, me or anybody else that I know. And when I ask them about it, it usually has to do with one big factor, and that is their kids. So I'm not saying you have to have kids to make these habitual lifestyle changes in your health, but when they start to think about what they want their interactions in their life to look like with their kids as they're getting older, with their kids, and potentially even their great grandkids, they start to stretch out the timeline of their life. And they look at the decisions that they're making as part of that in terms of, what they're going to be able to do at later stages of life, or even right now, right? Like my kids are very into basketball. And for me to be able to play basketball with them is harder than it was 10 years ago for me to play basketball. And it's going to be harder 10 years from now for me to play basketball. But I like to do it, and I'm still able to do it. And it's because I have to put a lot of work in other things so that I don't get hurt, so that I can still, play and run around and jump and cut and just have fun in the sport with my kids, right? So that's been a big driver for me. And I see this with a lot of other people as well. So this trend of longevity, and I would say, honestly, it's people between like 30 and 60. They seems to be the sweet spot where people are starting to change their views on how they want to treat themselves. And some of it might be generational differences. And some of it might just be information access that's out there. But either way, it's here. And it's something that you really have to continue to think about as part of your clinic if you want to be a part of proactive work. There's plenty of clinics where they just want to be, hey, we treat injuries and that's it. We treat injuries, we get you out of pain, and then go back to a coach, trainer, whatever it might be, that's totally fair too. If that's the type of clinic that you want to run. A lot of the clinics that we work with, that's not what they want to do. They want to help people get out of pain, but they want to have a more in-depth conversation about health, wellness, and longevity. We would always tell people we help people live high performance, pain-free life. That's the goal, right? What do you want to do? And do that for as long as you want to do it with the people you want to do it with, period. And we can make it work within that, right? We help you do those things physically. And we may have to incorporate other people into that as well. It's very common that we may have a little ecosystem of providers. But this central person, I'm going to make a case for why we fit so well here. That central person who we consider the kind of quarterback of the health and wellness world. I honestly feel like the performance-based physical therapist fits that so well. And here's why. Number one, if you're helping people get out of pain, you're developing a lot of trust with them. And they're obviously coming to see you because they can't do something that they want to do. So once you can get a better understanding of what's driving them, what they're trying to do, what their history is, and you can help them get through that early stage of out of pain, back to moving, back to the thing that they like to do, that's just step number one, in our opinion, right? Then we get a chance to ask them, what do they want to do? This was my favorite time of getting a chance to work with the patient. And this is always something that I think kind of catches them off guard, because they get to a point where they're good to go. They're back to, let's say, playing basketball again. And then, I get a chance to say, cool, Danny, you're back to playing basketball with your kids, your knees feeling better, whatever is bringing you in. What health goals, what fitness goals, do you have going forward? Is there anything that you're trying to continue to do or maybe you want to do that you haven't yet? And to sit down with an adult and ask them to set goals physically for what they want to do 5, 10, 20 years in the future. That is an interesting conversation to have. And it's something that a lot of people come away with that or from that with a very interesting interaction. And they're forced to really think about what they want and the things that they want to change or need to change to get where they want to go. Right? Like it's no different than having a financial meeting with somebody and saying, okay, cool. You're out of debt now. What do you want to do? What are you trying to fund your kids' college education? Are you trying to pay off your mortgage? Are you trying to be able to retire one day? Like, let's forecast this out and start to make decisions now based on where you want to be there. It's no different. It's just physically we get a chance to, have this sort of like goal session with them and ask questions about what they're trying to do. And then we get to reverse engineer what that is. Now, here's the other thing. Because you have built so much trust with people, they trust your opinion on filtering out the massive amount of bullshit information that is out there. There's so much bullshit, so much. Anybody that tells you that they read an article about something on the internet probably just saw a social media post. They saw an Instagram slide that showed a data point. They didn't read the fucking article, okay? Or they probably don't even know what they're looking at. That is all over the place. That's that person's brother, their coworker, their neighbor, their whatever. And if they're getting healthcare advice from somebody that's an accountant, it's probably not the best place to start, okay? And it's rampant. I get this all the time. People in my neighborhood, friends of mine, they'll be like, hey, what do you think about this? Or say, where did you see that? Oh, my friend sent me this post. And it could be totally legit. But they also get a bunch of stuff that's complete bullshit. And they don't know. That's the thing. They don't know because they don't know how to look at a study. They don't know how that relates to their individual circumstance. Healthcare is a nuanced discussion. It's not a blanket discussion. Not everybody's the same. Not everybody has the same goals. Not everybody has the same health genetics. There's a lot of differences there. And for us to be able to have a one-on-one conversation with people is a gold mine in as far as synthesizing data down for them, synthesizing information down that fits with them, their goals, their history, all of that. And you have trust with them. And now we get a chance to start to make true lifestyle habitual changes that are hard with somebody that's an accountability partner that is quarterbacking your health and wellness. Now, this may be well outside of your scope, you might think, as a physical therapist. What a great opportunity for you to learn more about this world, for you to learn more about program design, about energy systems, training people, nutrition, looking at biomarkers. making changes, sports psychology, actually coaching people long term. Oh, and when they come back in, you can use your hands to get things moving better. And they love that. What a fantastic combination of hands-on work, progressing things or making adjustments to what people are doing, working in conjunction with other coaches or providers potentially that need to be involved in that, depending on the complexity of what's going on and their goals, or in many cases, just you. And I saw this so much when I was in DC, so much. So many people were coming back to the clinics that we work with that are coming in proactively. They're coming in not to solve a problem, to not have a problem. Think about that for a second. Our profession is built off the back of we solve pain problems. If they have any marketing, that's what they've done a good job of, which is totally fine. But that's not all that we can do. And in fact, I think that's just scratching the surface of what people need. And more and more people are looking for this. So if you have a desire to work with people long term and have these true, lifelong health clients, people that you can help be that outlier 60-year-old, people you can help do those things they want to do with their grandkids, and they can start thinking about it before they even have them. That's where they make legitimate lifestyle changes, health changes, generational family health changes, because their kids see them making different decisions. Their kids see the fact that they don't drink anymore and they're drinking water. Their kids see the fact that they're still learning new shit when they're older and they're excited to continue to be a novice at something. Their kids see that their parent is going in and working with someone on a proactive basis to make sure that they can use their vehicle in life for as long as they can, doing the things that they like to do and experience the world around them. That's all it's fucking cracked up to be. Guys, that's it. A, you don't know how long you're going to be here. B, what's the point? If you don't enjoy the world with the people that you enjoy, doing the things that you enjoy, and help people along the way, what's the fucking point? That's why we're here. And we get a chance to help people experience the world in a very meaningful way. Don't undervalue that. People are looking for that, and they will pay for that. I see physical therapy going through a transition right now, at least the group that we work with that is more performance leaning. Very similar to how, dentists did a great job of marketing proactive work. And they have more on their side in terms of discomfort associated with a cavity filling, getting a drill out, extracting a tooth, a surgery. Nobody likes that. Nobody wants that, right? So, okay, if you're proactive, you come twice a year, we do some x-rays, we clean your teeth, you're good to go, right? You don't have to mess with these things usually. And there's things that pop up, whatever, but they've done a great job of proactive, keep your teeth as long as you can, don't get a cavity, all that. We're just now starting to do similar things. And I think that the best way to frame this is not, there's negative and then there's positive frames. A negative frame would be do you want to be the grandparent that's sitting on the sidelines watching your kids or watching your grandkids do all these things, these activities, and you're too physically unable to participate with them? Do you want to be the grandparent who has to get a power wheelchair to get around Disney with them as they're going and meeting princesses at the Magic Kingdom? Or do you want to be the one standing next to them in the pictures? That's a strong motivator. But I think it's in a negative sense. And if you can flip that and you can make it more positive, I love the frame of imagine if you were 60 and you were trying to PR your marathon from 3 decades before. You were in shape, able to do so. You were energized enough to do so. You had enough mental bandwidth to think through things that you wanted to continue to accomplish as you age. And you didn't look at it as falling off a cliff at that point. You look at it as, oh no, I'm still going strong. Imagine if you're the one riding all the roller coasters with your grandkids because you have no problem whatsoever walking 15,000 steps in a day at Disney. These imagine if scenarios are the ones where you can put people in a positive lens. Imagine if you are the outlier. Outliers, there's genetic freaks out there, don't get me wrong. But more often than not, when you really peel back the onion, these are people that have made decisions to do certain things differently than other people over an extended period of time. And that is where health really takes off. You start to make massive changes based on small changes that you make on a daily basis that lead to very big changes over decades. And that's what we can help people with. both with accountability, with information, curated, accurate information that's specific to them and help them sift through the bullshit that is out there and all the different biased things that come their way. Actual like true understanding of biomechanics and what people need to do to correct differences that they have, movement specific efficiencies that we can help them with, hands-on work that people value so much. Just think of this: massage therapy, chiropractic, acupuncture. People go back proactively to these three types of manual therapists, whether they're doing manipulation, hands-on work, needle work, whatever it is, proactively, and have done so for a very, very long time. Physical therapy has done a terrible job of fitting into that. And that is a place where we can honestly thrive. It's a huge part of what I would see as my caseload with people just like this, where they would come in, I would do some hands-on work proactively, ideally proactively, so that they are continuing to be able to do the things that they want to do, adjust a treatment plan, go over whatever we're working on as far as like education is concerned. And we could spend the whole session going over breathing technique for them to do down regulation before they go to bed. Doesn't matter. We can do whatever we want. That's the beauty of the cash model. Like, it's whatever the patient needs. It's whatever that client needs. But here's what you got to do if you want to fit into this type of a business model. Because not only is this good for your patients, but it's great for your business. And if you look at the numbers of it, imagine if your schedule was full of people that wanted to be outliers. They wanted to be proactive with their health. They wanted to come in on a regular basis. They saw value in what you do because it's helping them extend their life in a meaningful way, not just extend their life, but also extend their activity in their life. These are the people that are fantastic to work with. These are people that don't even feel like work, right? Solving problems initially in the evals, mentally, really hard, right? It's great to have a mix of that and people that are solving long-term problems, but they're being more proactive in nature. They're working more on performance and longevity. But what if 80% of your schedule is made up of that and 20% of it was new volume? Think about that for a second. Not only is that an easier cognitive load for you to carry long-term, an easier administrative load for you to carry long-term, but also the new patients that you continue to get spill over to other provider schedules. And it's just a trickle-down effect that occurs. So the next provider does the same thing. Now they need less evals. They need less evals, less evals. And when people do this right, we find that a full-time provider will need somewhere between 5 and 8 new evals a month. That's it, in order to have a maintained schedule because of how much they have coming back with continuity work for people working on performance and longevity. And if you can get to that point, it's just so much easier to continue to build provider schedules and provide an environment that providers can thrive in long-term without having so much burnout. It solves many problems if you're interested in leaning into that type of work. So it's great for the provider, it's great for the business, and it's great for the client. Win, win, win. I think this is the way that we are supposed to go. You know, I think it's this sort of convergence of the skill set that we have and the things that we can help people with. And the fact that people are seeking it out is changing dramatically. I used to have conversations with people about this, you know, towards the end of a visit, end of a package, and it's too late by then, right? It's like, dude, my back doesn't hurt anymore. What are you talking about grandkids for? You know, my kids are like 3. And now people are looking for this. Not only that, but you can have this conversation so much earlier. In fact, you should. First conversation. Hey, we're not like other PT clinics. I know we have physical therapists in here, but here's what we do. We're going to help you get out of pain and back to what you like to do. But more than anything, we help people live a high performance, pain-free life. And we want to help you do whatever it is you want to do for as long as you want to do that. And we want to be your partner in a outlier life, in an extraordinary life where you get to experience the world in a way that very few people do, with the people that you love doing things with, and do those for as long as possible at the highest level that you want to do those. That's what we like to do. So we would love to get your back pain, you know, back to where you want it to be. But after that, we got a lot of work we can do if you're interested in that, right? Set the stage from the beginning. Your providers need to be talking to people about this because people want this. And the coolest part is to see what actually happens when you can help implement these basic things, this level of accountability where they're coming back and they're seeing you on an ongoing basis. Don't discount accountability. Accountability is incredibly valuable. People pay for accountability in many, many ways. And you can provide that for people in a very positive manner, in an ongoing environment, an ongoing relationship with somebody that they trust you, where you're going to be the first person that they reach out to about a number of things, where then you can be that quarterback and you can send them off to other areas if they need to, or you can handle it in-house depending on the complexity of it and if it's within your scope of practice. That is a fantastic, fantastic place to be. I see the profession trending that direction. I hope that you decide that you want to lean into this as well, because you can help a lot of people. You can help a lot of people avoid a lot of medical issues, a lot of physical issues that are avoidable if they were to put a little bit of time back into themselves on a regular basis. And the fact that the market is shifting for this and we're here at the right time, I think it's amazing that we're hitting this just at the right time. I think over the next decade, you're going to see so much more where people are going to lean into longevity. And it's either going to be you, or it's going to be somebody that's a better marketer than you, that maybe is less skilled, has less credentials, cares less about their providers. And this is what always happens. When there's opportunity, great marketers come in and they try to swallow up that opportunity. You got to learn these skills on a business owner side so that you can get people in the right environment and really, really, truly help them. Otherwise, who knows what they're going to be, doing? Who knows what fringe shit they're going to do that has no actual evidence behind it? They're not practicing evidence-based medicine of any sort. They're not continuing to learn these things. We are. It's a great place to be. You got to own it, and I hope that you decide to do so. So, I thought this was pertinent. This is something that we're going to lean into heavily at PT Biz. We're helping people really develop these clinics that are designed to really help people long term, that are not dependent on just massive amounts of new volume like the traditional insurance model is and has to be, basically, because they cannot do this type of work. Insurance does not pay for it. And we get to fit in that area, which is fantastic. So hope that this is something that you decide to lean into. We'll have more information on this going forward. I'm super excited about this variation of the profession and to help everybody really implement this effectively in their business so we can help people live as healthy of a life as possible and do the shit they love to do with the people they love doing it with.